At the start of the Progressive Era, healthcare as well as overall health was very low for many Americans. 20% were killed by terrible epidemics in towns and cities. Some of these epidemics were typhoid fever, malaria, and cholera. Children were affected a lot by health problems as well during this time. Huge numbers of children died from measles, influenza, whooping cough, and scarlet fever. During this time period, there was very little knowledge about health, and there would not be any advances until the end of the 19th century. Very important health reforms took place during the Progressive Era. Many public health centers were established in communities. One of the main goals was to improve the sanitation so that the spread of the epidemics could be controlled. Health inspectors hired by local governments began to enforce regulations that required areas such as restaurants, businesses, and houses be kept sanitary. Also, the education of physicians was improved during this period because of the establishment of medical schools that were required to be licensed. This took place of unregulated training places for physicians that often didn't even require the completion of a high school degree. In some ways, though, the new system was flawed because doctors and hospitals were funded by the fees charged by patients. They were not paid like teachers were, and they did not receive any salary. Because of this, many patients were not able to pay for the care that they so desperately needed. Leaders during the Progressive Era realized that this was wrong, so they began to explore systems of healthcare that were publicly funded. They wanted each state to establish universal healthcare that could be funded by tax revenue. This idea was met with a lot of oppression, though, as many people saw it as un-American and socialistic.